Welcome back. Now, we know the increasing pressure NHS emergency services are coming under, especially throughout the pandemic. But there are now grave concerns over the amount of time patients are waiting for emergency ambulances. In Scotland, cases of people with suspected serious conditions waiting more than 10 minutes for an ambulance have more than doubled since 2019. Good friend of the show, Dr. Asim Malhotra, a consultant cardiologist and chair of public health collaboration, has experienced the impact delays can have firsthand. Just a matter of weeks ago, his father passed away as he was waiting for an ambulance. Asim joins me now. Welcome back. First of all, tell us what happened to your dad.
Good afternoon, Alex. Yeah, so I received a phone call from my dad just after 5 o'clock on Monday, the 26th of July, so almost 6 weeks ago. And my dad's very fit, he's not got any, he didn't have any background of heart problems, but he started telling me that he was having some chest discomfort. And very quickly, me as a cardiologist, that's, my speciality, I was able to determine that it sounded like it was coming from the heart. And I asked him to call an ambulance straight away. He seemed a bit reluctant, so he wanted to call neighbours, and therefore that's what he did. Despite my advice initially to call an ambulance, and the neighbours were doctors. I think he didn't want to really be alone at this situation, this sort of stage. So the neighbours came, and I was back and forth in phone calls with various people. And what happened is once they got there, they assessed Dad, called an ambulance because they were concerned clearly this was sounding like it may be a heart attack. And during that phone call, Alex, to the ambulance, he then went into, within a few minutes, he suffered a cardiac arrest. They started doing CPR. I had called back to check on Dad, and actually a quite panic-stricken doctor, who was a neighbour who was not expecting this to happen, basically told me down the phone that my dad had had a cardiac arrest and they were doing CPR on him. Now, what happened next is that I essentially tried to take control of the situation and reassure them, because this is a situation that I've dealt with many times in my career. I've managed thousands of patients with heart disease over the years, and many patients that I've treated in emergency situations have had a cardiac arrest out of hospital. And normally we get them in, the ambulance crew will bring them in, resuscitate them, and we would then take them to what we call the cardiac catheter lab and operate on them and find where the blockage is. So when this situation started, Alex, actually, I was quite confident because I know ambulance crews are supposed to respond within 10 minutes. And actually, in some ways, in that acute moment, although I was shocked, I also thought, actually, this is lucky that Dad had a witnessed cardiac arrest by two physicians, two hospital doctors, doing CPR on him while they're on the phone to the ambulance. So there should be no delay. And I told them, listen, don't worry, we're going to shock him out of this. But the ambulance didn't come. 10 minutes, 15 minutes, 20 minutes. It took over 30 minutes before the ambulance arrived. And they FaceTimed me at this stage so I could see what was happening in terms of the cardiac monitor being put on Dad. But it was a flat line. There was nothing to shock. He was gone at that stage.
And are you confident that if the ambulance had come within the stipulated 10 minutes, which is what it's supposed to do for an emergency response, that your father would still be here?
Absolutely, Alex. And the reason for that is, it's something actually interestingly I've campaigned on, I've researched on, I've published in medical journals on, is that actually in this sort of situation, the chances of survival, if the ambulance had come in time, would have been at least 50%, probably 75% in my dad's case, because a post-mortem later showed that Dad didn't actually have a heart attack, but what we call a precursor to a heart attack, unstable angina, which meant that his heart was otherwise strong, and there was much more likelihood that he would have had what we call a shockable rhythm from a defibrillator for at least probably 10, 15, maybe 20 minutes. So I have no doubt that he would be alive. I think something that then emerged later on, which makes the situation even more disturbing, is a very senior member of NHS England who happens to be a nurse. I spoke to her a few days ago, and she informed me that her own husband had suffered chest pain only a couple of weeks before Dad had his event. And she was aware that throughout the country, ambulances were not responding in time to these sort of category 1 or, life-threatening type situations, and decided that she wasn't even going to call an ambulance. So she put her husband in a car, he had chest pain, she thought it was a heart attack, and drove down the hard shoulder to the nearest A&E, and they diagnosed a heart attack. Now, if I had known about this information, or something that should have been shared, I think, with the public and doctors, because I was informed that the Department of Health and the government were aware of this situation, where many regions throughout the country are now asking for the army to come in and help with emergency responders. If we had known this, Alex, the whole situation would have been managed differently. I wouldn't have asked Dad to call 999. I would have asked the neighbour straight away to take him to hospital, and he would have got there in time. And if he'd had a cardiac arrest, they would have been able to shock him out of it, and he'd be alive today. So given this information, everything that I've heard from reliable sources, I tweeted this today, I'm directly holding the government responsible for my father's death. And I suspect there are many other people that are dying that otherwise would have been saved or would have been managed differently if the public were aware of this and doctors were aware of what was going on.
What on earth is going on? What is behind this? We live in a developed world country. We expect if us or one of our family members, a neighbour, a stranger, is in abject emergency, that you're going to phone 999 and an ambulance will come on time. I mean, why is that not the case anymore? We can't have people just flying up and down hard shoulders because ambulances aren't turning up.
Alex, you're absolutely right. And, let's just emphasise one thing, the flagship gold standard in the NHS for many years, one of the best response times in Europe and management of cardiac patients has been in the NHS. And that is clearly failing now. And for me, that is a symptom of an NHS that isn't at breaking point, an NHS that is broken. So let's talk about why. It's something I've been writing about well before even COVID for many, many years. I think two major issues. First and foremost, we have a staffing crisis. Even before COVID, there was we know that there's 100,000 shortage of nurses and doctors in the NHS, while demand has been increasing. More recently, there's been a shortage of paramedics as well, 30% shortage apparently, I was told, combined with increasing demand. And what's driving that demand, Alex, which we have discussed many, many times, is the fact that we have failed to tackle prevention. Most of the demand on the NHS is now being driven by diet-related disease, by obesity and its related conditions, heart disease, type 2 diabetes, even cancer, Alzheimer's. This is what's driving most of the demand on the NHS. And we failed to tackle it because we've not addressed the root cause, which is the food environment, and the structural drivers of disease, what I call the commercial determinants of health, which is basically all of the things that encourage people to lead unhealthy lifestyles. And until we address that at the root, this problem is only going to get worse. I mean, it's been, over 10 years since I started being an activist and campaigner, really to save the NHS, because working as a cardiologist, I could see that there was so much stress on the system, even 10 years ago, that there was no slack left. And we've known since 2004, the World Health Organization announced obesity as a global problem in 2004. And I could see more and more people coming with chronic conditions, most of it related to lifestyle. And for me, I started that journey 10 years ago, really to save the NHS from getting to this stage. And unfortunately, we are now at this stage. I've lost now 2 family members, in many ways related to the fact we haven't tackled prevention and the fact that NHS resources are now under too much strain. The basic care is not even now being provided for patients. It's a really horrible situation that we're in. But I think, let's accept, that the NHS is broken, but let's now work on rebuilding it, because it's a cherished institution. I think there's so many amazing things that we have achieved over many years through a National Health Service. And we need to continue that, Alex, otherwise we're all going to ultimately suffer because of it.
Yeah, I couldn't agree more. And what a horrible, alarming situation we're in. And my deepest condolences to you, because your father really was a great man who had a profound impact on the National Health Service here in the UK, and is remembered and missed by a great many people. So thank you so much for coming on and talking to us about that today. That's Dr. Aseem Malhotra, consultant cardiologist and chair of the Public Health Collaboration. Well, now, the North West Ambulance Service spokesperson has given us a comment and said, "We offer our sincere condolences to Dr. Malhotra and his family and can confirm we have received a formal complaint from him." They went on to say, "We are investigating the incident and will liaise with the family to discuss the matter further."